This is Scott Becker with the Becker Private Equity and Business Podcast. We come to you daily with short business episodes, short private equity episodes, as well as interviews with brilliant private equity and business leaders. We try our best to both have people learn something from the podcast, plus have some fun with it as well. We're joined today by two brilliant leaders from BSM Consulting, now part of VMG Health. We're joined by Maureen Waddle, a senior consultant, and Katrina Whitehair, a consultant as well, both brilliant. We're going to talk about private equity in healthcare today. Maureen, Katrina, can I ask you to take a moment each to introduce yourselves? Maureen, why don't we start with yourself?
Great. Thanks, Scott. My name's Maureen, as you said, and I have been working in the eye care industry primarily for almost 40 years and have certainly seen a lot of changes, especially in the past 10 years with the market consolidating and the private equity activity. And it has just been amazing to watch the changes and the growth and all the activities that are going on with eye care practices. And then I also work a little bit with medical aesthetics, which is Katrina's area of expertise. So I'll turn it over to her.
Thanks, Maureen. I'm Katrina. I'm also a consultant at BSM, and I specialize in medical aesthetics. So I work in plastic surgery, dermatology, and med spas. Historically, I've also been in the eye care space. I've been in healthcare about 12 years now, and pretty split. I started in the ophthalmology space and have been in the medical aesthetic space for the last 7 years and have seen that market and private equity enter that market and have really been a part of that emergence.
I mean, it's fascinating in both areas. Ophthalmology and private equity has been a match for a very long time. Aesthetics, medical spa, and so forth seems to be just exploding in terms of private equity interest in the growth of that industry. But Maureen, let me ask you a question about private equity in healthcare. A lot of attention to it recent years. Talk to us a little bit about specialty care and private equity. What are you seeing at a high level, specialty medical care markets that are attracting private equity? What are you seeing out there?
Sure. Well, of course, my expertise is in ophthalmology, so I'll stick with what I think attracted private equity into that space about 10 years ago is really a couple of things. One, very disparate. We still have a lot of private practices out there with a need to consolidate because quite frankly, the regulatory environment and the expenses and the practices, they need to come together. So whether it's private equity or the own practices, mergers and acquisitions are happening. But the thing that's attractive about ophthalmology in particular for private equity practices is they have a significant amount of cash basis, not just the insurance, but cash pay services, whether it's refractive cataract surgery or LASIK or optical, or on the oculoplastic side, some of the medical aesthetics and the practices. And then they also can take a hub and spoke approach around an ambulatory surgery center, which is a very attractive asset in these situations where they can buy practices and drive surgical cases through to an ambulatory surgery center. And, certainly other specialties have that capability as well to maximize the assets that they have in place at these ambulatory surgery centers and really drive the capacity, which makes them far more profitable. So that has been, I think, a key component and strategy in the ophthalmology space and then some of these other specialty areas.
Thank you. And take a moment on, you mentioned partially cash pay, and obviously we'll talk more about cash pay in a second with Katrina and medical spa and aesthetics and so forth. But do private equity funds view that cash pay as a recession challenge, or they view it as a nice hedge against the reimbursement from commercial payers? How do sort of investors view that cash pay portion of these businesses?
Yeah, I think it's a diversification strategy, quite frankly, right? To not be too dependent on the medical insurance payers and especially Medicare, which keeps decreasing their reimbursement to the providers. And so while it is impacted by, economic conditions, certainly it also booms, when things are right. And so I think it's just a diversification strategy and an opportunity for growth.
Thank you very, very much. And Katrina, there's been seemingly an explosion in the medical spa space. I see incredible numbers of money being invested there and growth in the revenues there. What are you sort of seeing around medical aesthetics in the med spa world? Give us some thoughts around those, if you don't mind.
That's a great question, Scott. And I think, just like how ophthalmology started, there's a growing aesthetic market. There's a younger population interested in aesthetics. There's a boom in social media and there's more information and exposure. So it is booming. The pie is growing in aesthetics. And just like the ophthalmology and eye care markets, the PE is interested for the same reasons. There's profit opportunity. This is cash. We don't deal with insurance in medical aesthetics. So there's, opportunity to have a strategic advantage, have access to advanced training and development, have cost efficiencies, and capitalize on that demand that we're seeing, as the market is growing. It's got the same drivers.
Thank you. When you look at the different factors in private equity, investing in healthcare, whether it's in ophthalmology, a whole host of other specialties, or medical spa, or aesthetics, what's your sense? And I'll tee this up for both of you. Your sense of factors that private equity should be looking at as to whether doing acquisitions, bolt-ons, platforms, or they're building things de novo and building new facilities de novo. Thoughts around that, particularly, I guess, in the medical spa world and the aesthetics world versus the ophthalmology world, where it's probably harder to build things totally de novo. Maureen or Katrina, do one of you want to take a first stab at that question?
I'm happy to start on the aesthetic side since we're kind of a newer, emerging, exploding market. I think, de novo or acquisition really depends on your risk tolerance. Going acquisition, your structure's already there, your foundation's there, your profit streams are there. It is more costly to acquire a practice, but there's already those structures in place. So I think if you're considering de novo, it works best if you have a hub practice to start with that has that solid foundation, those efficiencies there to then build your de novo strategy and market. But really, de novo is all about location and doing that research, assessing the market, assessing your demographic data, making sure it's in the right place. If you have a hub practice, you don't want to open a practice 30 minutes away in the same, urban area because you're going to be saturating your existing market. So I think it's important to decide what your strategy is and then really look at your market and decide what makes sense for your operation.
Thank you very, very much. And Maureen, did you want to comment on that as well?
Yeah, I'll just add to, the consideration of de novo versus acquisition. I think one of the advantages of de novo is you get to build on your brand, certain brand name, and you get to start immediately with the processes and systems that you have refined. Whereas if you go an acquisition method, now you have to go through integration, maybe even change the culture of the people that you're working with because they were running things a certain way. So while the systems are there and there's a cash flow there, so that's the nice part. It's often harder to make changes as opposed to opening a de novo center where we can just hit the ground running. So I would just say that's something to think about strategically too in making that consideration. In the more mature market like ophthalmology is, I think we're seeing more de novo activity just because the acquisition or the number of practices who are interested in selling have kind of been bought. And so now if we're going to open into new markets, there's not a potential acquisition there. So we're having to look at more de novo opportunities to satellite and expand.
No, and that's fascinating. And it must be challenging too which is, you mentioned the number of doctors that have already sold, that wanted to sell, practice that wanted to, and no longer available to sell because they've already done that. It's also got to be challenging doing de novos or acquisitions, just because the sheer number of doctors coming out versus number of doctors retiring, just overall the shortage of doctors issues must provide some challenges as well. Maureen, any thoughts there? I mean, that must make it a little challenging.
It's quite challenging, and in ophthalmology, you've probably seen, Scott, that we have a great shortage of ophthalmologists right now compared to the demand for eye care services. And quite frankly, we've been turning to optometry to fill that gap and provide more and more, at least medical eye care services, to free up the ophthalmologists for doing surgery. But it is definitely a challenge in the industry.
Thank you. And then Maureen and Katrina, I'll ask you this question. Private equity has become a large part of the economy, an investment part of the economy. There are periods of time where people say that private equity can conflict with the medical values of healthcare, which have to be so patient-centric and so critical to mission is taking care of patients. At the same time, private equity makes a lot of great inroads into healthcare and a lot of positivity and then some negativity. Any red flags that people should think about as they look at private equity in healthcare? Where could it be okay? Where could it go wrong? What should people be thinking about? It certainly gets lots of political demonization, but Maureen or Katrina, do you want to take the lead on that, and what red flags are things that people should consider?
Sure, I'd be happy to start, and I'm sure Katrina has some thoughts as well. But I think, selecting the partner, like if I'm looking at it from a practitioner's perspective and potentially selling to private equity, selecting the right partner, I think where they can truly add value is with all of the support mechanisms behind the patient care. So, for example, the IT system, software, billing, claims, all of the automation that needs to be put into place, and the expertise that goes along with doing that well. I think, private equity management companies bring that to the table, bring certainly, the capital to invest in doing some of these acquisitions or de novos or building the surgery center. So when they stay in their lane where their expertise truly lies, I think it's good for all that we've got this expertise and the money to back the growth or the infrastructure necessary to achieve the growth that is the vision for these platforms. And as long as, we're not trying to force certain, number of patients per days on doctors or those types of things, which we've seen attempts at. But I think it can indeed be a good relationship and a good marriage of expertise to back the medical practitioners' efforts to provide the best service to patients.
I think you're spot on, Maureen. And, in ophthalmology and in the medical aesthetic market, we are a people-dependent business, and we rely and help maintain and build relationships with people. And we want to make sure that we partner with the right company. And I think, when you're a solo practice or you're a med spa or if you're a private equity firm, I think it's important to establish your mission, your vision, and your values. Who are you? What do you stand for? And where are you going? And with those guardrails in place, you can make informed decisions about who the right people are to partner with and what makes sense for your growth. Or, if you're part of that boomer generation who's thinking about succession planning, does it look like private equity would be a great marriage for that transition time? So I think, having that clear vision will help make decisions, and you will have a lot of opportunities to say yes, but having those guardrails will help you identify when to say no.
Thank you very, very much. I think that's just fantastic from both of you, and understanding if you're selling to private equity, make sure that you really are comfortable with the participants. You've talked to the references, you understand the use of debt and how much leverage, what happens if margins fall, a number of other issues that can impact whether it ends up being a good long-term partnership or not. Katrina and Maureen, brilliant work that the both of you do at BSM/VMG Health. Any final thoughts that you wanted to share with us today? Katrina, I'll start with you, and then I'll let Maureen wrap up today. Katrina, any final thoughts you wanted to share with the audience today?
Sure. Yeah. Thank you, Scott. I think, medical aesthetics, even though we're a cash-based business, we still have a set of, compliance, governance, guidelines, and regulations to follow. And, consolidating is in aesthetics is still healthcare, right? We're still talking about healthcare consolidation. So having a thorough due diligence, a thorough market assessment, and really having that data to inform your decisions, whether you're buying or selling, is going to really drive that. Thank you.
Yeah, thank you for the opportunity, Scott, to talk about, these important issues. And even though ophthalmology's been involved with private equity and consolidation for quite some time, I still think we're only in, maybe at the halftime of the football game, right? We've still got great opportunities and growth, and being very critical and strategic in how we approach this is going to make the difference for long-term success. I really like what Katrina talked about with just setting your guardrails, knowing your mission, vision, and values to drive that strategy, and helping you select the right partners as healthcare continues to evolve to the next and different levels.
Thank you very, very much. I want to thank both of you, Maureen Waddle, Katrina Whitehair, two brilliant leaders at VMG Health, part of the BSM division of VMG Health, but both brilliant. Thank you for talking to us about specialty care and private equity. I know we spent a lot of time on medical spa as well as ophthalmology, but the conversation traces to lots of other areas. And I know you folks do a work across the board in private equity investing in specialty care. Thank you so much for joining us today on the Becker Private Equity and Business Podcast.
Thank you.
Thank you so much.